All right, guys and girls, it's jerningham here. We got doctor to door testing carrying out in parts of England for South African variant. Could it be Brazilian variant, like I said in the other video? Oxford variant. Other variants in the UK we don't know about. And others that are coming in we don't know about too. Let's play the video.
Mass testing will be carried out on tens of thousands of people in 8 areas of England in an urgent bid to halt the spread of the new South African strain of coronavirus. Ministers have urged everyone in the affected postcodes to get tested, whether or not they have symptoms. The latest 24-hour government figures show a further 406 people have died with COVID. Figures reported on Mondays are traditionally lower, bringing the UK total to more than 106,000. There have been another 18,500 new cases in the United Kingdom, and another 319,000 people received their first dose of the COVID vaccine yesterday. More than 9 million people have now received their first dose of the vaccine. It's still early stages, but scientists say data suggests the vaccines will still work against the South African variant, although they may be slightly less effective. Two of the areas targeted for the surge in testing are in Woking in Surrey. Our reporter Aisha Tal is there. Aisha.
Well, from tomorrow, these boxes, including these tests here, will be sent out from this fire station, going to particular addresses in GU21. And there's only a few streets actually in this postcode that they are going to test in this way. Now, you've got 150 volunteers who will be coming together to do this testing and going out and knocking on doors. Inside these boxes, you've got these tests, and these COVID tests that we've become so familiar with, they'll be going in through doors, and it's to see how prolific the South African variant is. We know that loads of cases of COVID are asymptomatic, so it's to get a true sense and a true picture of what
Live
really
working
is
this minute.
going on with this variant. Surge testing is on its way in Woking, as with 7 other postcodes in England. That means COVID tests sent through letterboxes for anyone over 16 in these areas.
I think it will take probably realistically until the end of the week to do those tests. We'll go back if people are out and knock a couple of times. So by the end of the week, and then hopefully that will be it. We'll leave residents.
Another annoying advert.
To carry on.
I hate these bloody adverts.
Using music as a tool to push culture forward.
There you go.
About 80,000 people across 8 postcodes in Kent, Hertfordshire, Walsall, Sefton, Surrey, and 3 London boroughs will be tested. 105 cases of the South African variant have been found. 11 are not connected to travel. Well, this is what 10,000 tests look like. Inside those boxes, you have these COVID tests, and anyone that has had a test before will be really familiar with these. In this particular area, they're finding out door to door what COVID cases there are, whether you're symptomatic or not. But for some in the area where tests will be carried out, there's concern.
It's a bit scary, but it's good that they're doing it door to door. So yes, I'd be willing to, do that.
Yeah, it's concerning.
Well, I guess they have to do what they have to do to try and calm things down, I guess. And if testing is the way they need to do that, then I reckon everyone will be okay with it if it makes it better. So
no problem, I'll just do it. Yeah, if it saves the community, we can get back to work, back to school, back to normality quicker. I'm all for it.
There's currently no evidence to suggest this variant is any more severe. But
There's Matt Hancock's the secretary for the UK, speaks about the stuff.
The South African variant being in the UK since late
Like
December.
an MP.
The difference now is the fear of spread in the community without contact with anyone who's been to the affected country.
Well, I think it's more contagious probably because it's quite similar in one part of the virus to the UK variant, which is also more contagious. So what's happened is basically a change has occurred in that bit of the virus that sticks out from the surface, the so-called spike protein, and that makes the South African variant more sticky and more infectious. But actually, that's the same type of change that's occurred in the
There's
UK.
loads of diseases across the world, not just coronavirus. Some we probably don't know about.
How global this pandemic is. A variant originating here, now having this big response in the UK, and a stark warning that COVID can evolve, and the battle against the virus is very much ongoing.
Aisha Tull reporting. Well, now joining us now is Professor Anthony Hondon. He's the Deputy Chairman of the Joint Council for Vaccines and Immunology. Thank you so much for joining us, Professor Hondon. Now, given the geographical spread of these cases, could the South African strain of the coronavirus be in actually more locations than the 8 areas we now know about where this testing is going on?
Well, we don't know that yet, John, and that's one of the things that we'll be looking at. But what we do know is that Britain are leaders in genomic sequencing and will be working very hard to find out through our surveillance systems quite how widespread this virus is. At the moment, it looks like it's localized, and we will be doing everything that we can do to try and contain the spread. What the public need to be really reassured about is that the vaccines that we've got at the moment are safe and effective against the major circulating strains within the UK, and we strongly suspect it will be very effective against the South African strain as well.
Is door-to-door testing a good strategy? Is it reliable and effective?
Well, I'm involved in the vaccine, not in the epidemiology of the testing, but I do believe that these measures that Public Health England are putting in place are world class, and they will lead to very careful analysis and surveillance of the epidemiology of this South African variant.
You know, to we laymen, the word variant is becoming spooky. I mean, are we eventually going to be able to outwit all the vaccines, all the vaccines, are the variants themselves going to outwit all the vaccines that we develop?
Well, I think we're just going to have to live with the idea of new variants. This virus does mutate and will carry on mutating in different parts of the world and within the UK. What we need to be ahead of is in terms of how we tackle this. It's nimble, but we need to be nimble in return. And we can be confident that actually these vaccines are very easy to edit and tweak. And at the moment, the scientists are working furiously behind the scenes to make sure that we have an edited vaccine that's available for the strains that are circulating at the time. I do think that we are going to be in a position where we have to have an annual coronavirus vaccine, and that annual vaccine will be tailored to the variant strains in the UK at that particular moment. So it's something we just got to get used to. It's not spooky, it's not scary, it's to be expected, but we do need to be very vigilant and ahead of the game.
Now, are we really going to be able to outwit the South African variant? Because we've been told all along that it is stronger than anything we have had homegrown here.
Well, the evidence is at the moment that it isn't more virulent, i.e. it doesn't really cause more disease. And we do know from the vaccine trials that have been done in South Africa itself with the circulating virus that these vaccines are very effective against severe disease and hospitalization. So I fully expect, even if the effectiveness is slightly reduced against mild disease, that we're well on course to prevent hospitalizations and deaths in our vulnerable communities. So it's all steam ahead with the vaccination program, and public would be confident that the vaccines they're receiving are the right ones for them at this time.
Professor Hondon, thank you very much.
Another advert again. Hate these adverts. Anyway, the thing's finished on there now. So this is going to be door-to-door testing carrying out in parts of England for South African variants. You'll see at the beginning of the video, I may speak about the title, what it's going to be like, but the title's going to be different where I am going to be putting it. Because I like to have different titles, and I like to do the same thing. Somebody else does on their own titles. So anyway, what do you guys and girls think? Will it spread to Scotland, Northern Ireland, Wales? This new variant with different areas you don't know? It could be going into different countries. We already know it's in America. Anyway, thank you for joining this video. Peace.